Dentin hypersensitivity is characterized as a short, sharp pain emanating from exposed dentin that occurs in response to a stimulus that cannot be ascribed to any other dental defect or pathology. Some stimulus is hot and cold, applied air to the teeth, contact with instruments, sugars or salts, and acid from foods and beverages. What is dentin? Can you guys explain dentin to me? Did you guys go over what dentin is already?
It makes up most of the teeth.
Okay, anything else, you know?
It's softer than an enamel.
Alright. And it's also very sensitive. Yep, exactly. So dentin is sensitive calcified tissue, which forms the bulk of the tooth structure. It surrounds the pulp of the tooth and is covered and protected by hard tissues, including enamel and cementum. It is composed of tubules that act as portals as sensitivity stimuli such as cold and hot temperature. So this is just a close-up picture, a little bit. So the darker area is the dentin, and those are the tubules that extend from the outer of the tooth into the vital pulp of the tooth. Any questions at all? By the way, does anybody experience any sensitivity on the teeth? You know, we do.
Number 29.
Is it constant all the time, or just?
Mine's more hot sensitive actually. I have like on the tooth and stuff.
It's still sensitive. You don't get recession in that area? Quite a bit of recession? Okay.
I think it's my bite actually, because I get adjusted a whole lot. The bite on it, so.
So a couple more things about hypersensitivity. It's referred to as one of the most painful and chronic dental condition. Reported prevalence between 4% to 57% in the general population and 60 to 98% of the periodontal patients. It's typically more seen in women than in men. Affects patients of all ages, though mostly coming among those ages between 20 and 50, and the peak occurring between 30 and 40. And it's seen more in canines and premolars on the buccal aspect of the gingival area. And us as hygienists, we usually are typically the first ones to be aware that patient has this type. And do you guys have any reason why, like, you know, I can't talk right now, sorry. The reasoning behind that, like why we're the first ones usually aware of this?
We're so close to the diamond.
And another one is, especially with new patients, we're typically the first ones to see those new patients first. And a good idea is to document that, so every time a patient comes in, you could go back and read your notes and just familiarize yourself with that, so you're not going back into that area forgetting that that patient's sensitive, so patients appreciate that. And obviously patients are very sensitive in most areas. So does anybody want to read the differences between sensitive dentin and non-sensitive? Okay.
If I can, I think I can see it, okay. Hypersensitivity dentin, ends of dentin tubules are open to the oral cavity. Tubules are larger and more numerous. Smear layer is thin, poorly calcified, or what does it say, breached? Okay. Non-sensitive dentin, fewer dentinal tubules at the tooth surface. Smear layer is present, or tubules are occluded by mineral compounds.
Is this a new topic for you guys, or have you guys kind of briefly went over it?
Yeah.
Any questions on this slide? And did you guys hear of this before? The reasoning behind? Ever heard of that? Hydrodynamic theory is the most widely accepted explanation of dentin hypersensitivity. It proposes that the hypersensitivity is caused by the pressure of the nerve resulting from the change in the fluid found within the dentin tubules. The changes in the fluids are caused by stimulus. Thermal activity. I have a little video that's going to go and explain a little bit of this for you guys. Hopefully it helps.
Ice cream, hot coffee, cold air. When people suffer from dentin hypersensitivity, the everyday things we take for granted can trigger pain. But what's really at the root of dentin hypersensitivity? When dentin becomes exposed and tubules are open at the dentin surface, people can experience the pain and discomfort of dentin hypersensitivity. Gingival recession is the primary way in which dentin is exposed in the cervical region of the tooth. Once the root is exposed, the protective layer of cementum can easily be removed, resulting in open dentin tubules. But what is the connection between these open dentin tubules and pain? Based on Brandstrom's hydrodynamic theory, dentin hypersensitivity is caused by movement of fluid in open dentin tubules. Heat, cold, air, and pressure can cause this rapid movement of fluid in open dentin tubules. Each of these stimuli produces a movement or disturbance of fluid in the dentin tubule. This change in fluid flow causes a pressure change within the dentin, which activates the infradental nerves, causing a signal that is interpreted as pain.
Any questions about that video at all? So patients who are at risk to experience dentin hypersensitivity are those who may have gingival recession, inaccurate attached gingivals, nutrition, abrasion, effraction, periodontal surgery, ortho, teeth whitening, and other dental treatments. I had 2 implants placed, and the premolars in front of those teeth are extremely sensitive, to the point that I don't want anybody touching them whatsoever except for me. So I'm the only one that cleans those teeth because I'm beyond sensitive in those areas. So, and people that do not experience this, you guys are so lucky. But just keep in mind when you are dealing with these type of patients, and it's extremely sensitive to them. And be very gentle in those areas, and just see if they want any breaks from when you're in there and stuff like that. Just be very cautious for that patient. Here's another short video.
One of the most common problems in dentistry is sensitive teeth. If you have sensitive teeth, you may feel discomfort when they're exposed to cold air, hot or cold food and beverages, or sweets. There are many possible causes for the problem, including improper stresses on teeth, loss of the tooth's protective enamel layer, and occasionally some dental procedures. One of the major sources of improper stresses is the unconscious habit of grinding and clenching the teeth. Another source of stress occurs when teeth don't come together properly. Some teeth always hit sooner than the rest, and they become sensitive. Teeth also become sensitive when they lose their protective outer layer, exposing the dentin. The dentin is the middle layer of the tooth, and it's normally protected by enamel above the gum line and cementum below it. Dentin contains millions of tiny tubes that extend from the nerves at the center of the tooth to the outer layer. When the dentin is exposed, these tubes are left open. Any stimulation at the surface of the dentin is transmitted through the tubes to the nerves, causing pain. The dentin can become exposed through various processes, such as abfraction, erosion, and abrasion. Abfraction occurs when one tooth hits sooner than the rest, causing the tooth to flex. Over time, continual flexing causes the enamel to separate from the dentin. Erosion occurs when acids dissolve the enamel. This is often caused by the frequent sipping of acidic soft and sports drinks, or exposing the teeth to stomach acids through acid reflux disease or bulimia. Abrasion takes place when the protective layer is worn away. This can happen when you brush too hard, use a medium or hard bristled toothbrush, or use an abrasive tartar control or whitening toothpaste. Lastly, some dental procedures, such as bleaching and placing restorations, may sometimes lead to short-term sensitivity. Left untreated, tooth sensitivity can have far-reaching effects. Sometimes it stops people from brushing and flossing their teeth properly, which can lead to more sensitivity, decay, infection, and even tooth and bone loss. To determine the cause of your tooth pain, we'll perform a thorough examination. If the problem is improper stress on teeth, we may adjust your bite or recommend that you wear a mouth guard. If the problem is exposed dentin, we may present a plan for improved brushing techniques, counsel you about your diet, treat the area with fluoride, or apply a protective coating or bonding agent. Short-term sensitivity can often be handled by using a desensitizing toothpaste or mouthwash. With proper treatment and care, your sensitive teeth can once again be healthy and comfortable.
So just like the video was kind of mentioning already, some ways to handle sensitivity. There are some home remedies and in-office procedures too that can help with sensitivity. Some at home are mouth rinses, and now they have these strips. I personally haven't tried the strips before, but some of my patients did, and they say it works really good. And some toothpastes as well. I personally always use Sensodyne toothpaste. I'm not trying to sell my product or anything, but I have to use it every single day because my teeth are extremely sensitive. I have a very hard time whitening my teeth because my teeth are so sensitive. And here are some in office, which they already kind of spoke of with the night guard to help with the clenching, and some chemicals that can cover the area and seal those pores that cause the sensitivity. Fluoride, I hear it works. It doesn't work for me. It lasts like maybe 1 or 2 days, and then after that it's sensitive right after that. But some have better experiences with it than I do. So this is just to show you what happens to those pores when some of those chemicals are used to help the sensitivity. The pores are open on top, and once the product is applied, the pores are closed and covered, and it helps with the sensitivity. You guys get on that? Understand on that? Is there anything you want to add to that?
What's in the pores is organic. And when you bleach your teeth, what happens is that material that's in the pores is what makes your teeth look yellow. And when you bleach your teeth, the bleach actually goes in and bleaches the material that's in the pores. That's why you're able to bleach your teeth. It doesn't really change the color of the enamel of your teeth, but it goes through the dental tubule or the tubules in your enamel into the dentin and into those pores, and then it bleaches what's in the pores. So when it's bleaching it, it's also kind of cleaning it because it's hydrogen peroxide. That's why it hurts so much. It hurts a lot. But that's how you're able to bleach your teeth.
Any questions after that?
You do get patients that get real frustrated. There is stuff that works. Fluoride varnish can help. Fluoride varnish is only accepted in the United States as a therapeutic for dental sensitivity. It's not accepted for caries control, although it is in Europe and we know that it is. There's the Colgate that you saw that you can burnish in with a rubber cup. There's the fluoride that you can use at home. It does work for me. Sensodyne. The other thing you can do is if you really want to bleach is take Sensodyne and put it in your bleaching tray and wear it for like a half an hour and then take it out and then bleach your teeth. That's a way. The other trick that you can use if a patient has exposed dental surfaces or dentin is the only part that's sensitive is what's exposed in their mouth. We as hygienists are going for what's in the sulcus. So what you want to do is take a little tiny bit of the end of your Explorer. Just make sure that the sulcus is clean, because that's what we're concerned about. You don't have to touch the stuff that's going to make them jump and scare you, and if afraid that you're gonna stick them with your Explorer because they jump so hard.
And sometimes people with recession, I've seen dentists actually put a composite over that area to help patients with that sensitivity. But a lot of them tend to pop out right away too, so. It does help once it sticks in there, but a lot of times they tend to pop out fairly easy.